Hello and welcome. We will be discussing medications used to treat attention deficit hyperactivity disorder, ADHD. ADHD is a neurodevelopmental disorder that affects both children and adults. It is characterized by symptoms of inattention, hyperactivity, and impulsivity. There are several medications available for the treatment of ADHD, including methylphenidate, amphetamine, and atomoxetine. Let's take a closer look at their uses, mechanisms of action, side effects, contraindications, warnings, and pregnancy and lactation information. Medications used to treat ADHD are primarily used to improve attention and reduce hyperactivity and impulsivity. They are also used to improve academic and occupational performance, reduce behavioral problems, and improve social functioning. Methylphenidate and amphetamine are stimulant medications that work by increasing the levels of dopamine and norepinephrine in the brain. These neurotransmitters are involved in attention and motivation. Atomoxetine is a non-stimulant medication that works by blocking the reuptake of norepinephrine, which also increases its levels in the brain. Like all medications, ADHD medications can cause side effects in some patients. Common side effects include decreased appetite, difficulty sleeping, stomach pain, headache, and irritability. In rare cases, these medications can also cause serious side effects such as cardiovascular problems, psychosis, and suicidal thoughts. ADHD medications are contraindicated in patients who have a known hypersensitivity to any component of the medication, as well as in patients with certain medical conditions such as glaucoma, high blood pressure, and heart disease. They should also be used with caution in patients with a history of substance abuse or addiction. Patients taking ADHD medications should be monitored for signs of cardiovascular problems, such as chest pain or shortness of breath. They should also be monitored for psychiatric symptoms such as agitation, anxiety, and depression. Patients should not drink excessive amounts of caffeine while taking these medications, as this can increase the risk of cardiovascular problems. Pregnancy and lactation. ADHD medications are not recommended for use during pregnancy, as they may harm the developing fetus. They are also not recommended for use during breastfeeding, as they may pass into breast milk and harm the nursing infant. In summary, medications used to treat ADHD are primarily used to improve attention and reduce hyperactivity and impulsivity. They work by increasing the levels of dopamine and norepinephrine in the brain. While they can cause some side effects, they are generally well tolerated. Patients should be monitored for signs of cardiovascular problems and psychiatric symptoms and should avoid excessive caffeine consumption. ADHD medications should not be used during pregnancy or breastfeeding. Information for this video was obtained from Lexicomp and Medscape. If you have any questions or concerns about taking medications for ADHD, please speak with your healthcare provider. They can help you determine which medication is best for you and provide guidance on how to manage any side effects that may occur.